I'd say that when diagnosing the condition, taking patient history and using palpation under the plantar heel, that's usually sufficient. And then we can also use ultrasound. That's something that we have been using in the research that I've done, and that's because we want to include those that have an increased plantar fascia thickness, because the treatments that we've been using are targeting the plantar fascia. But we are aware that other structures can be involved in producing pain under the plantar heel. Macmillan found that in a review of diagnostic imaging, that a person with plantar heel pain is 105 times more likely to have plantar fascia thickness of 4 millimeters or more compared to pain-free controls. What studies usually find when they look at pain-free controls is that the plantar fascia is somewhere around 3 to 3.5 millimeters thick, and the 4 millimeters is also what we use as a threshold when we do research on plantar heel pain. So this is what we see on ultrasound. On the right hand side, you can see an image of a healthy, non-painful plantar fascia, and on the left hand side, this is from a patient with heel pain. There is a larger hypoechogenicity, also an increased thickness, and it's usually also much more difficult to see the border of the plantar fascia. This yellow line is just to indicate where we would usually make the measurements. We do these perpendicular to the plantar fascia and to the calcaneus. If we look at the recent clinical guidelines, there are some extra factors that need to be considered in order to diagnose plantar heel pain. What they say is that we should use what you need to have is a positive windlass test, a negative tarsal tunnel test, limited ankle range of motion, abnormal foot posture index, and then you need to have a high BMI in non-athletic populations. So this is just based on the clinical guideline. I'd say that it doesn't really make a lot of sense if you can tick all of the boxes, but then you look at the patient and say, no, it can't be that because you're just too skinny. So there are things that I would consider. If, for instance, if I don't use ultrasound, and based on patient history and how they say their pain evolves during the day, if it gets worse when they are in standing, for instance, then I might do just a tarsal tunnel test or look for a Tinel's sign. But other than that, I would say that it is quite easy to diagnose based on this.